Is recognized for 5 minutes.
Thank you. Thank you, Mr. Speaker. This is the final amendment to the bill, which will not kill the bill or send it back to committee. If adopted, the bill will immediately proceed to final passage as amended. I rise today on behalf of the families and communities across the nation that are confronting a public health threat of our time: heroin, fentanyl, and prescription opioid crisis. This motion would simply ensure that the health insurance plans that today's bill would permit must still cover substance abuse disorder treatment, including for opioids as an essential health benefit. Under current law, we require insurers to cover this treatment. Before the Affordable Care Act, many insurers either didn't cover treatment at all or imposed onerous requirements that blocked people from getting needed care. H.R. 1101 would roll back that guarantee. It would allow association health plans to return to that kind of skimpy coverage that left so many people struggling with an opioid disorder in dire straits at critical moments. We know there's often a narrow window of opportunity after an overdose, for example, for someone to commit to treatment. And these are the moments when being able to make a single phone call can make all the difference. This week's debate about health care is extremely important. Will we decide to work together to improve the American people's access to quality, affordable health care, or weaken benefits and kick 24 million or more of our constituents off their plans? We all need to speak up on behalf of those whose lives have been turned around because they can now access health care. As I talk to families, medical professionals, and law enforcement in my district, I hear stories that highlight the dramatic impact that improved access to coverage has had in making treatment a real option for people with substance use disorder. This week, we see that basic coverage is under serious threat. In fact, experts estimate that repealing the Affordable Care Act's coverage provisions would cause about 2.8 million Americans with a substance use disorder to lose some or all of their coverage. And the quality of that coverage is also at risk. Thanks to the Affordable Care Act, insurance must now cover treatment for behavioral health and substance use disorder just the same as it would cover any other medical service. These parity protections mean insurers must cover treatment for substance use disorder with comparable cost sharing, no more surprises like annual visit limits, higher copays, or frequent pre-authorization requirements and medical necessity reviews. Badly needed facilities are opening because plans now cover these services. I recently visited a recovery home for pregnant women in my district and new mothers, and they were able to open the doors this year in my hometown only because it could rely on Medicaid expansion. Legislation like H.R. 1101 would cause fewer people to have this coverage, meaning fewer facilities can open and treat. Many of you know that my home state of New Hampshire is on the front lines of the heroin, fentanyl, and prescription opioid crisis. Our communities are struggling, and helping people get treatment is key to turning the tide. I have met people who couldn't be in a recovery facility without Medicaid expansion. Today, members of Congress can say to my constituents in New Hampshire and their constituents across this great nation, we hear you. We know your sons and daughters, your nieces and nephews, your neighbors and your friends are struggling, and we have your back. We believe all Americans deserve good health insurance they can count on when they need it most. We aren't going to throw the rug out from under people who are about to turn their lives around. I urge my colleagues to support this motion, which would not delay passage of the underlying bill. Thank you. I yield back.